Hi, I'm Kathy from Simple Fit Physical Therapy, and today we're going to talk about hip bursitis that is also known as trochanteric bursitis. The bursa is a fluid filled sac that sits over the greater trochanter and is covered by the IT band, also known as the iliotibial band. When this bursa gets compressed, it causes friction. Over time, that friction can lead to inflammation, and the inflammation can lead to pain. Today, I'm going to show you several things that you can do at home to help manage bursitis, but stay until the end because I'm also going to tell you some things that you need to avoid. So, if you press on the outside of your hip and you feel like it's tender, that could be bursitis. Because hip bursitis is a compressive disorder, it oftentimes becomes compressed because of tightness in the external rotators. So that's the first stretch I'm going to show you today. So I'm going to lie down on my back and I'm going to bring one hand on the outside of my knee and the other on my chin. And I'm going to pull up towards my chest and to the opposite shoulder. So right now I'm pulling towards my right shoulder and I'm feeling a strong stretch right in those hip external rotators all back and through here. When I do this stretch, I'd want to hold it for about 30 seconds and I'd want to repeat it about 3 times. Even though you may only have a problem on one hip, you might want to go ahead and stretch both sides. The next stretch I'm going to do is a single kneaded chest stretch. So again, I'm going to lie down on my back and I'm going to bring my knee up towards my chest and give it a gentle hug. I'm going to hold it about 30 seconds and I'm going to repeat 3 times on each side. When you're doing this, you should feel a stretch through the buttocks on the side that you're stretching. The next exercise we're going to do is a bridge. I'm going to lie down on my back and I'm going to stabilize a little bit with my hand. My feet are about 3 to 4 inches apart. I'm going to tighten my stomach muscles as I lift my hips up and I'm going to hold this position for a few seconds before slowly lowering it down. When you're doing this, if you feel like your hamstrings are starting to get a little cramp in them, what you can do is bring your feet back a little bit, lift up your toes to kind of dig in your heels, and then lift from there. That kind of takes the hamstrings out of the picture and makes it so you can do the bridge focusing on the glutes. For these, you would do 3 sets of 10 repetitions. The next exercise I'm going to do to target the glute is a side lying hip abduction. I'm going to have the bottom knee bent to help keep me stabilized. I'm going to put my hand on my hip just to make sure I'm not rocking back and forth. And I'm going to lift my leg into the air, keeping my toe pointed forward and my hip extended. And I'm going to slowly lower it down. Now, if you have hip bursitis on both sides, these might be difficult to do on a floor like I'm doing. So you might want to do these on a softer surface or get a thicker mat than the one that I'm using here. The next exercise we want to do to target the gluteus medius is a clamshell. So we're going to bend both of our knees. Again, I'm going to put my hand on my hip just to keep my hip from rolling forward and back. We just want it to be stable. And we're going to lift up, hold it for a moment, and come back down. If it's a little bit too easy for you to do this exercise without resistance, you can put a resistance band just above the knees and do the same thing. Lifting up the knee, hold for a moment at the top, and then slowly lower it back down. The next stretch you can do is a stretch using the stick roller. You can find these on Amazon. I'll put the link down below. If you don't happen to have one like this, I'm not sure if they're even making this specific one anymore, but you can use a rolling pin or a foam roller, anything like that that you have. And so what you'll do is you'll start just below the greater trochanter and you'll stop above the knee because you don't want to get into the bony part. So we're just going to roll down the outside of the thigh. And you'll do this for about 3 to 5 minutes. What you want to do is if you find any spots that are a little bit tender, or if you have any knots, just kind of get in there and roll them out. And that's going to break up those knots and loosen up that IT band. And today mine's a little tender. So, as I mentioned at the beginning, there are several things that you do want to avoid if you have hip bursitis. The first one is that you don't want to sleep on the painful side. So, if I have pain in my right hip, I would want to sleep on my left. And if I'm sleeping on my left hip, what I would want to do is put a pillow between my knees to help keep that right hip in a better alignment. A pillow between the legs will help keep that top hip from overstretching if it happens to fall down. Another thing you want to do is when you're standing, you don't want to shift your weight onto the painful side. If you stand like this with your hip kind of jutted out to the side, it's going to overstretch those structures that are causing you pain. Instead, what you would want to do is stand with your weight evenly distributed on both feet. The last thing you'd want to do is avoid sitting with your legs crossed. If you sit with your legs crossed, what it's going to do is it's going to add a little extra stretch to that area. And for right now, that's really not what you need. You want to just sit with good posture, as always, with your feet both flat on the ground. Well, I hope you enjoyed these tips today, and I hope it helps you if you happen to have a bursitis. But as always, check with your doctor before you start any new exercise program. Hi, Jersey. Well, that's all I have for today. Please like and subscribe if you enjoyed this video, and let me know in the comments below if you had any trouble with these exercises or if there's any other conditions you'd like me to discuss. Take care, and I hope to see you again soon.